let's say, unfortunately, we have had to cope with COVID-19 pandemics for the last almost 2 years, and COVID-19 has had a real impact in all the cellular therapy strategies, both in the stem cell transplantation landscape and also on the use of CAR T cells. And this is quite a complex issue because the impact of COVID-19 in cellular therapy strategies has been kind of multifactorial. First of all, I think that, at least from a Spanish point of view, and I think that this is exactly the same situation being seen in other European healthcare systems, many of the efforts of the public healthcare system has had to move to the treatment and diagnosis of patients with COVID-19. So in a sense, the prioritization of even the diagnosis and treatment of patients and that are COVID-19 negative have suffered from that. Being transplantation and CAR T cells clear examples of the need of a multidisciplinary team. We have found ourselves with difficulties of reaching other specialists, including ICUs, that were absolutely blocked with the treatment of patients being infected by COVID-19. And this is one thing that has had a clear impact also in the way that we have been using cellular therapy strategies during COVID-19 pandemic. And also what has happened in many centers is that the transplant team, in terms of human resources, starting with physicians and then of course with nurses and other healthcare professionals, has been significantly disrupted with infected professionals, with quarantine professionals, and sometimes with professionals who had to join COVID-19 teams, so that have been diverted from hematology, for instance, to these multidisciplinary teams that were organized to treat COVID-19 patients. In addition to that, and when we talk about unrelated donor transplants, we have had to take care with all the problems associated with the transportation of hematopoietic progenitors across borders, with all the issues with couriers, with, of course, the disruption of transportation around the world, with potential donors being COVID-19 positive, and with the need to be able to quickly develop a clear network of SOPs that allowed us to handle unrelated progenitors properly. And what has happened in Spain is that, in a kind of opposite way to look at the different waves of COVID-19, the activity in terms of unrelated donor transplant has also significantly decreased and has gone up and down depending on the situation of the pandemic. And finally, of course, the scientific societies have developed clear guidelines to try to balance in the best possible way the risks of transplanting somebody or treating with CAR T cell a patient with the additional immunosuppression that this represented, and the potential risk of having patients infected by COVID-19, which is one thing that, of course, all of us have had, and we have quite a lot of information on how these patients have performed in the course of cellular therapy. And of course, balance one side the risk that we had to assume, and on the other side, of course, the specific need that the patient had in terms of stem cell transplant and CAR T cells. So in fact, the reality is that the direct and indirect damages of COVID-19 pandemic have been really important in the landscape of cellular therapy.